We have three presenters for our session today. The first presentation is an overview of types of, and characteristics of shift work and the concept of shift work as a complex exposure scenario by Dr. Roel Vermeulen. Dr. Vermeulen is an associate professor in the Environmental Epidemiology Division of the Institute for Risk Assessment Sciences at Utrecht University in the Netherlands. He's also an adjunct professor in molecular epidemiology at the University Medical Center at the same university. His research focuses on occupational and environmental risk factors for cancer, asthma, and neurological diseases. He is currently participating as a co-investigator in the Nightingale study, a prospective cohort study on shift work and breast cancer among non-nurses. Thank you.
Thank you very much for the introduction and for the opportunity to talk here today. I'm going to try in the next 50 minutes to talk a little bit about shift work and what shift work is, and really go into the complexity of shift work and try to make the case that shift work is actually a complex mixtures of exposure scenarios, which I think is important to realize. I just wanted to have a first conflict of interest statement here. I'm from that country there that has the most light at night in Europe, so that's just for your information. So the first question that I wanted to address is basically what is shift work, and of course it's very easy just to go to the web and basically ask, look at the ILO definition, and basically you get to that it is work organizations that allow to work more than the normal hours. And the EU definition is something similar, where it is different people working at the same workstation to allow longer working times. If we then go back to how we actually have basically used that in the scientific literature, then we basically have a somewhat different definition, and we say that it's generally includes work circumstances that are other than the standard daylight hours. That is basically the definition that we're having. And if you have that definition, then basically you're talking about regularly scheduled work outside the normal daytime working hours between 7 or 6 p.m. So if we talk about shift work, which is a little bit different, and so this is contrasting a little bit already the light at night discussion, we're talking on one hand permanent night shifts or working during the night, but we're also talking about afternoon shifts or evening shifts, or shifts that actually start extremely early, before 6 a.m., which means that people have to get up in the middle of the night to actually get to work. And in some way, those can actually be much more disruptive than actually thinking solely at the night shift itself. The other point that has been made, and I just want to make this very clear, is that when we look here on your left side, is a panel in blue are the evening shift. So this is the prevalence of evening shifts. And let me see if I can get this to work. Yeah. And the pinkish red here are night shift. And the lighter color is 1 to 5 times a month, and the darker color is more than 5 times a month. And if you look at these distributions, you actually can see, and this is for Europe, that currently about 40 to 50% actually works outside the normal working hours. So that includes evenings or other shifts. If you think about night shift, it is actually 20% of the working population is in some kind of night shift at a certain moment in time. Of course, this happens in transportation and healthcare and so on. The point that I wanted to make here is that we're looking not at a rare exposure. And all the talks that we have had today is about cancer, breast cancer, which is not a rare disease. We're talking about cardiovascular disease. We're talking about metabolic functioning, which are all very prevalent diseases. And so actually the health impact that we can have on the population can actually be quite high. And that's why I think this meeting that we have here today is really pertinent, because we actually may be facing one of the most important, at least from an occupational perspective, risk factors that we actually have been looking at for a long time. if we actually look at epidemiological studies, and I'm just borrowing this, and I know that it's difficult to read, but I'm just borrowing this from the overviews that you made for this meeting, just to show that the way that we have been looking at epidemiological studies at shift work is quite a mess, to be frankly. And that's not how you summarize the information, and it's not how I actually put it on a slide, but it is because we actually have different questions. Sometimes we look at permanent night shift, sometimes we're looking at rotating shifts, sometimes it's long, sometimes it's short. All the definitions in the epidemiological studies are actually quite different, and I think Johnny will probably reflect on that in his talk as well. When you actually start putting that data together, you may or may not be surprised that you get heterogeneous results. Similar as Richard Stevens pointed out, that all these meta-analyses come to us the different conclusion. It is what exposure metric do you choose? And we actually haven't really dealt with what the exposure metric is, and I will come back to that later. This is just another slide, again, pointing out that this is really the point. So when we were at the IARC evaluation, I think what struck is basically that we actually, when we look at shift work and in relation to health, we kind of treat it as a dichotomous variable. It is either shift work, yes, no, times duration. It's always night, yes, no, evening, yes, no, rotating, yes, no, number of shifts. And we do that either on an individual level, which most of the studies have done, sometimes on a job title level when we use job exposure matrices. And when we went through that literature, we really realized that that is inadequate. We're not really capturing probably the essence of what we need to measure in shift work. And so in the follow-up meeting that we had, and where Richard Stevens was really instrumental, and Johnny was there as well, is we basically started to think about, well, what would actually be needed for the next studies to be actually measuring to really capture shift work. And I keep on saying shift work, and I will try to translate that to circadian disruption, but purposely I'm now saying shift work. And we basically came up with this list. So it is basically knowing if people work at night. We have to know something about the duration, because we think, and if you look at the epidemiological literature, that the longer duration has an impact. It has to do with the intensity. What are the numbers of non-day shifts that people have? The permanent nights, the rotating, if that's continuous, if that's discontinuous, the direction of the shifts, the rate of rotations, how many days are there within the rotations, and so on. How many morning shifts are there really? What are the rest periods? And so this is a whole new list that we actually need to have to actually start addressing really this issue of shift work. Because at this time, we actually don't know exactly what we measure with a question, how many times in your life have you worked between midnight and 6 for more than 3 hours in that period? And so we don't know exactly what that is. And that is important because of two reasons. One is that we want to reduce measurement error. We do want to get a better estimate of what shift work is and what shift work entails. And that is true, and I come from the measurement error arena, and so this is automatically what I would say. Well, we get more data, therefore I reduce measurement error. In this case, I'm slightly thrown off here because I don't know exactly which measurement error I'm looking at. And then so if we then go to circadian disruption, of all those variables, which one is really the one that I need to reduce my measurement error on circadian disruption? And so that's a very difficult question. So in this case, we're trying to reduce the measurement error in something that I'm not entirely sure what that entity is. And so I think when we talk about how biomarkers can help, I think that's exactly the area where it becomes important. We also need to actually go into these details, and that has to do with what Richard already said, that if we actually go to interventions, shift work is not going to disappear. What we can do is actually arrange it in a different way, therefore may it be less disruptive or less hazardous for health. And so when we think about interventions, we actually have to know more about what aspects of that actually are driving potentially the associations we're seeing. So In the study that I'm the co-PI together with Muddy Rokas on the Nightingale study, we're actually trying to do this. And so when you look, and I won't go through the whole list below here, we actually have taken up the list that we produced at IARC to actually go through and reconstruct from everybody in the cohort, these are 60,000 nurses, to actually have exactly what their shift works were, what their rotations were, how many rests they had in between, and so on, to actually start addressing the question, not if shift work is related to adverse health, but what aspects of shift work may be related to adverse health. This will take a few years to basically render results, but in the first things we looked at, one of the things that starts to be interesting is that when you look at the 9060s, 9069 of the people that are in the cohort, they basically had about 7 night shifts per month. And on average, they had about 7 in a row. But if you see what happens is basically that over time, the number of night shifts actually have decreased in the population. What I also can see is actually the number of night shifts that actually are consecutive is going down as well. And if you look now at the baseline, which was 2011-12 of the nurses, then it's about 3 nights in a row or 2 nights in a row is what the majority of the people have. So actually, what we were looking at previously, potentially in the nurses' health study, is an exposure that actually is changing over time. It's not exactly the same exposure. And that's why we actually have to have this information, because you can actually expect that you get heterogeneity in the results because of these characteristics that actually are changing. Interestingly as well is that if we actually look at forward rotating or backward rotating, there's only 1%, less than 1% that is going backward. There's only 40% that is actually having forward rotating, and 77 is variable. There is no schedule at the moment anymore because they actually are allowed in the hospitals to do free scheduling. So they actually can interchange shifts with each other to actually make it work with their social life. But that means actually that the structure is actually quite variable, and that complicates quite significantly the studies that we are doing. So this is basically the first step, basically saying, okay, I have shift work, and I can look at the numbers of shifts, I can look at how many shifts they have per month, I can look at how many days are in between when you again have a shift. But in reality, I actually think that it's even more complicated than this. And so if I think what is really exposure to shift work, then this is basically what I think we are looking at. And so we have shift work that we just talked about in the previous slides, but actually with shift work there is disturbed social patterns. So actually the home environment changes as well for people that have shift work. There are differences in lifestyle aspects. If we think about physical activity potentially, or actually how people go in their life, may well be different between shift workers and others. There's a disturbed sleep pattern. There may be differences in eating patterns. There is a difference at light at night, potentially, or during the whole day. So when we can talk about those as confounders, which we often have mentioned these, I'm not too sure if that actually is the right term. They're actually aspects that actually come with shift work, and they may be intermediates, they may be the exposure itself, or they may be the endpoint you're interested in, but they're actually all 3 of the above. And that is important to start to realize, because how you actually parameterize your epidemiological analysis makes quite a bit of difference how you actually look at that. And I think we have to start looking at the totality of shift work with all these aspects that actually are related to that. Of course, then we talked about this a lot as well. Then we have chronotype that actually interacts with all these things as well. So the other thing that I just wanted to raise, and that was brought up yesterday about chronotoxicology, is that I can look at this, and this is really looking at shift work in that isolation. But of course, there are other exposures that potentially happen in these occupations as well, and how do they interact? And I'm just going to do a kind of provocative thing here, and that is just to take studies that have been done in the offshore industry, where there's a lot of light at night, a lot of shift work that's going on for actually a long period of time before they actually rotate off a platform. There actually are a lot of exposures that happen on these platforms. One of them is benzene, and benzene tends to be one of my hobbies. And so when we look at this benzene and leukemia relationship, the blue line here is the relationship between cumulative exposure in ppm years and the risk of acute myeloid leukemia. And this is based on all the studies that have been published to date, and this is basically the meta risk analysis that you get. Now, there's one study that has been done on platforms where the exposure is much lower, but the risks are much higher. And so I'm just bringing this up as one of the areas that we haven't really explored is what actually happens to other carcinogens or other exposures that actually may be hazardous to health that actually happens during the time during night shifts when our biological systems are not optimal functioning. And can actually some of these observations among shift workers where the exposure differs be explained by that. So one of the things that we are currently doing, and that's really in line with a lot what has been said today, is basically starting to describe this shift work as a multidimensional exposure and starting to understand how this all relates together. And so we're currently doing this study where we're actually looking at people that do shift work, in this case nurses, but actually measure their social patterns, their lifestyle patterns, their sleep patterns, their eating patterns, and their exposures during shift work, and see how all these aspects actually relate to shift work by using questionnaires, active graphs, light sensors, and by actually looking at the biomarkers in urine, blood, and in feces to actually look at the microbiome, how that actually changes among shift workers. And we do that by looking at long-term shift workers, short-term shift workers, and day workers to understand what actually changes over time when you do this for a longer period of time. I'm not going to go into these details, but this has been said before. There are changes that happens in sleep behavior when you look at people that are in shift work, which is important for a lot of biological systems. If we look at the light meters, we can actually show that people that actually have night shifts overall have less light exposure than other people, and that's basically during the daytime. Of course, they have more light during the night. Another very quick result that I just wanted to flash by is that we have been talking about changes in eating habits when you're doing shift work. We just did an analysis to look at overall, do shift workers have different eating habits than non-shift workers? Because most of the days you're not on shift work. And actually the result of that analysis shows that there is very little difference between shift workers and non-shift workers on their normal dietary behavior. So we have to ask ourselves if these 2 nights a month are important enough to actually change the whole metabolic system or not. So just to go back to this scheme, what I wanted to convey in this very short 50 minutes is basically when we look at shift work as a model for light at night, I think that is probably too simplistic. Shift work has a light at night component to it, but it is a multidimensional problem, and we have to treat it as a complex exposure scenario. To really understand it, we have to actually be able to relate those aspects to biological relevant exposures. And this is really, for me, the key question: what is really here biological relevant? And that may depend on the health outcome we're looking at, what really biological relevant is. And we don't know this. All these aspects that I just showed are interrelated, and we don't know exactly how they are interrelated. And we need to know that if we want to implement them in epidemiological studies and make them more meaningful. So the last question that I just wanted to pose is a full understanding of biology necessary for a public health intervention. This was exactly what Richard Stevens was pointing out before. the answer is, for cigarette smoking, no, we can interact based on that. We know that shift work may be at first related to health, but it won't go away. So to actually have meaningful public interventions, we do have to know which aspects are really important when we talk about shift work. So that's basically just what I wanted to say. I just wanted to thank Daniela van Langenberg, the Ph.D. student that works on this project, Matti Rokus of the National Cancer Institute, and the people that you know from the stuff that was just shown by the non-circadian circadian markers. Thank you very much.